As men get older, prostate cancer becomes a more common worry. It comes with its own set of problems and treatment options. This kind of cancer starts in the prostate gland, which is an important part of a man's reproductive system and is found between the bladder and the rectum. The risk goes up with age, especially for men aged 65 to 74. Treatments range from methods that might cure the disease in its early stages to long-term care for people who have it later on. In this video, we will talk about some of the ways that prostate cancer can be treated and whether it is possible to cure the disease. Can early-stage prostate cancer be cured? The chances of beating prostate cancer are very good if you are found to have it early on. In medicine, cured usually means that you haven't had any signs of cancer for at least 5 years. Nearly all people who are diagnosed with localized or regional prostate cancer will still be alive after 5 years. This amazing number shows that almost all people with prostate cancer that hasn't spread to other parts of the body or to nearby structures will still be alive 5 years after being diagnosed. But if the cancer spreads to other parts of your body, like your lungs, liver, or bones, your chance of life drops by a lot. Early evaluation is very important because it greatly improves the chances of treatment working. Prostate-specific antigen (PSA) testing isn't always the best way to find out if someone has prostate cancer. Experts say that men aged 55 to 69, especially those who are more likely to get prostate cancer, should talk to their doctor about the pros and cons of getting PSA tests on a regular basis so that they can make an informed choice. In general, guys over 70 years old should not get a PSA test. If you are suffering from prostate cancer and want to know enlarged prostate treatment, then go to the link in description and watch complete video. Can doctors cure prostate cancer that is spread? There may still be aggressive treatments that can possibly fix your prostate cancer if it has spread, but the outlook is usually not as good as it was in the early stages. About 1/3 of people who are identified with distant prostate cancer are likely to still be alive 5 years later. Cancer in stage 4. Most cases of prostate cancer in stage 4B, which has spread to other areas, can't be cured. There are, however, medicines that can help keep the cancer under control, ease the symptoms, and maintain the best quality of life for as long as possible. It's possible to live for years with advanced prostate cancer as long as you focus on managing your symptoms and enjoying your life. It's very important to know about the stages of cancer in detail. Go to the link in the description and watch the complete video. Different ways to treat prostate cancer. What kind of care you should get for your prostate cancer depends on how far along it is and your health. For men with early-stage prostate cancer, doctors may choose active surveillance, which means closely watching the cancer with PSA blood tests every 6 months and digital rectal exams every year. This helps keep track of changes and figure out if stronger treatments are needed. Watchful waiting with fewer tests is suggested for some patients, with the goal of managing their symptoms rather than treating the cancer. Surgery, radical prostatectomy to remove the prostate, radiation therapy, using high-energy beams or radioactive seeds, hormone therapy, to lower testosterone levels that fuel cancer growth, chemotherapy, to kill cancer cells that divide quickly, targeted therapy, using drugs that specifically attack cancer cells, and immunotherapy, to boost the body's natural defenses against cancer, may be considered if the symptoms change. Each treatment has its own benefits, and you should choose one after talking with your doctor in depth about what will work best for your situation. How long do you have to live with prostate cancer? If someone has been identified with prostate cancer, their life expectancy may be about the same as that of the average person. This depends on how advanced the cancer was at the time of diagnosis and other important factors, such as their age, overall health, and how well they respond to treatment. Many men with limited, low-grade prostate cancer have a good quality of life and are not likely to die from it within 15 years of being diagnosed. Statistics show that only about 1 in 5 older men with low-grade prostate cancer will live past 15 years. These men usually die of things that aren't related to cancer, like conditions that come with getting older. In conclusion, prostate cancer is a big worry for older men, but it can sometimes be fixed if it is found early. In the early stages, treatments range from those that might cure the disease to those that are more about managing symptoms and extending quality of life. Early detection is very important for better treatment outcomes, so it's important to screen and diagnose people on time. Advanced prostate cancer might not be able to be cured, but there are medicines that can keep it under control and improve quality of life for many years. To stay up to date on our useful content, don't forget to subscribe, share, and comment.